taking a little time to discuss men's health and one particular issue a lot of guys may not realize that they're experiencing, but they know the symptoms. Let's find out all about low T.
Low T. Dr. Brent Sharpe, Northeast Georgia Urological Associates, joins us on the line now. Dr. Brent, you doing well today?
I'm doing wonderful. Good morning.
Yeah, low testosterone has another name too, doesn't it?
It does. It has goes by the medical term or condition of hypogonadism.
Yeah,
it's a hard word to pronounce.
Yeah, we like low T better.
I like low T. The fewer syllables, I can handle that one.
But you see a lot of commercials about this. You hear a lot said about this. But what is the what's the real lowdown on this? Is it really commonplace among men?
It is real common. It's estimated about 5 to 10 million men over the age of 40 will have it. About 500,000 cases per year newly diagnosed. Men a lot of times go symptomatic for quite some time without seeking some advice, and it can simply be diagnosed by a blood test that they can have done with any of their physical exam.
What are some of the symptoms they might be experiencing? Because it could be guys experiencing this now, and they're like, there's nothing wrong with me, I don't think, but I just don't feel right.
Right, and that's a very common symptom. I just don't feel right. I don't have the energy I used to have. I need a nap in the afternoon. You can have a low libido. There can be some weight gain or difficulty losing weight. All these symptoms are signs of that, and they need to be checked along with some other things. But again, low T is something that we ought to be prevalent in looking at because it does probably increase your risk for having a cardiovascular event, which is heart disease is our number one killer in America. And by dropping your testosterone, you actually increase your risk.
So men, well, no, Bill's got 405.
No, I just didn't know that. I was wondering. I didn't realize that was one of the. That kind of frightening. I didn't realize that was a case
there's been a lot of publicity about it in the past, probably 3 years, but more concentrated in the past 18 months, where one study suggested there was a increased risk if you took testosterone replacement. That study has been disproven several times, and there probably within the past 6 months, a couple studies, most prominently the VA study, which came out, which said that men who had low testosterone took therapy but never followed up, never got it up to a level, had a higher cardiovascular event, which is heart attack, heart disease, needing stents, et cetera.
Dr. Brent Sharpe with us this morning from the Northeast Georgia Urological Associates, and we're talking about low T. Hey, is it something, for example, I could look at somebody could look at me and say, you got low T, or do a lot of people kind of come to your office and I'm just kind of feeling run down. I just got iron, poor blood, those kind of things.
Right. I'm just getting old, so this is what happens when I get old, right?
Yeah. Can you spot it a mile away?
Well, we can spot that symptom that they're going to tell us, I'm tired, I don't have the energy, and I just feel like I'm getting old. And the aging process is normal, and we're never going to feel as good as we did when we were 20, but there's no reason that we need a nap every 3 o'clock every afternoon, that we don't have the energy to do what we enjoy with our family, our work performance. Men can actually have depression or inability to concentrate because of low testosterone. So there's not a one symptom that says, hey, I probably have this. I think if you have some of those symptoms, do a little reading online and simply ask for a testosterone level. And again, I know we talk a lot about men's health, but women actually have testosterone. And if they have those symptoms, in addition to their female hormones they need checked, they should have a low testosterone.
Okay. But it never entered my mind because I'm telling you, 99.9% of the talk is always about men, isn't it?
No, it certainly is. When you think low T, that's the first thing I think, testosterone. And so all those guys. But let's go back a moment when you're talking about the studies. Okay, so with hormone replacement or therapy or what have you, as you treat this, I guess number one, I should ask how you treat this. Number two, what are some of the side effects? Because are there side effects to the treatments?
Well, first of all, you can treat it by a couple of different ways. First, it's most important for behavioral modification. Try to work on weight loss, eating a good, healthy, balanced diet, and exercise. Second thing, there's an over-the-counter medication that you can take that will boost your testosterone. If people choose to do that, they should be under the care of a physician so they can monitor levels. There are some things you have to monitor. And then there's the medications that we have, actual testosterone or a drug called Clomid, which will raise your testosterone. Those come in the form of shots.
Wow, we just lost Dr. Brent there. Okay. But I tell you what, it's easy to find out more. All you got to do is go to their website, and that is neurology.com. Did I get that right?
No.
ngurology.com.
Yeah,
ngurology.com. And you can give their phone number. Their phone number there is 770-535-0000. 770-535-40, as in 0000. Not
quad zero.
There you quad zero.
Yeah.
And they'll be glad to help you at Northeast Georgia Urological Associates. They do a great job. They really are. And gosh, you know what? this is a part of health that sometimes people don't want to talk about.
Yeah.
They want to kind of bypass, don't think about. But this is good information that Dr. Brent Sharpe brings us as one of our experts here on the Bill and Joel Morning Show.
And I didn't realize that about low T. I just thought that was, you felt tired, fatigued, low libido. I didn't realize that it could lead to heart disease. I didn't know that. That's frightening. That's something you need to have checked. So, guys,
it is. And there are other things, too, as well.
Yeah,
Weight
guys,
gain, ED, all these kind of things.
And you can't get rid of the weight. That's the problem. You get it, and you're like, why am I not getting rid of I used to be able to do this, and I'm not eating, and I'm not getting rid of it. It's really a mystery sometimes.